This is a brief introduction to the occupational health aspects of general practice in the UK. Occupational health is a medical specialty concerned with the interaction of an individual's health on their work and their work on their health. This video covers the effect of worklessness on a patient's health, the key role a doctor plays in helping employees return to work, what factors might influence whether a patient is fit for their work, and the support and rehabilitation services that the patient can access. An independent review of the scientific evidence regarding work's impact on health by Waddell and Burton showed strong evidence that unemployment is generally harmful to health, including higher mortality, poorer general health, poorer mental health, and higher medical consultation, medication consumption, and hospital admission rates. We should bear in mind how worklessness impacts on an individual's health and indeed its wider socio-economic impact. Doctors have been shown to have an important role in the prevention of long-term worklessness through our interactions with patients over sickness absence. Long-term sickness absence has a poor prognosis. If someone is absent for over 6 months, there is less than a 20% chance of a return to work. We need to think of return to work as part of clinical management. It's important to consider what barriers stand in the way of an individual's return to work and how we can help them overcome them. We can use the biopsychosocial model to structure our assessment of barriers to return to work. We should consider the impact of the physical illness and its treatment, and how this might affect the function in the role. For example, has it affected mobility, concentration, or power? How might this affect their safety, their travel to work, their hours of work? We should then explore the patient's psychological state and particularly identify if they've developed depression or anxiety, things that may influence their confidence about returning to work, and this should be actively managed. Finally, some social barriers can prevent return to work. For example, if they have additional carer responsibilities, if they come from a culture of worklessness, and in particular if they feel that a return to work might be harmful to their health. Issuing a fit note offers the general practitioner a chance to explore these barriers to return to work and consider what adjustments might enable a safe but earlier return. Employees often feel that they need to be 100% fit before they can return to work, when in fact, with the employer's agreement, adjustments can be made to make it possible for them to return to work gradually or avoid activities that have become dangerous or difficult to do because of their health condition. The Department of Work and Pensions guidance about fit notes reminds us that we should time limit our fit note absence periods and use any available evidence to do this, because absence can have very negative outcomes and employees can lose their job through absence even with a fit note. Finally, we should avoid labelling work as a causative factor without clear evidence of this, because this makes return to work significantly more difficult for the patient. The Royal College of Surgeons has an excellent website called Get Well Soon that provides return to work advice after common operations. If you are concerned that your patient is struggling to return to work, there are a number of support services you can access. GPs can refer by phone to the Fit for Work service, a government service staffed by occupational health advisors who have access to a certain amount of rehabilitation services. Any individual starting a job or returning to a job with disabilities requiring significant adjustments can apply for funding for this through the government's Access to Work Fund. Larger employers may offer occupational health services, rehabilitation and employee assistance programs. There are a number of excellent charitable services that offer both the employee and the employer support in the return to work process. For example, Mind, the mental health charity, and Macmillan, the cancer charity. Both of these organisations offer the individual significant web resources, training and one-to-one support. In addition, the Equality Act puts a duty of care on the employer to be flexible in how much they adjust work to support those with disabilities working successfully. When considering fitness for work, it is important for the physician to consider how the illness has impacted on the individual's ability to function. Relying on job title alone can be misleading about the level of fitness required to return to a job. For example, a librarian may not only handle books, but may also use ladders, and therefore needs to be safe to work at heights, and also may drive a van. Returning to certain types of work before you're fit may cause a serious risk both to the individual and to members of the public. Examples of such safety critical work include any work in the transport industry, any work where loss of consciousness could affect safety, such as work at height or depth or with moving machinery, anywhere where employees can potentially infect others, such as food handlers or clinical workers, and any work with significant hazards. So in many safety critical roles, national standards of fitness for work exist to guide clinicians, and many employees have access to specialist occupational health advice. So to summarise, returning to work is generally beneficial for patients' health, and doctors play a key role in supporting this. Once you've ensured there are no significant health and safety issues related to the health condition, you can explore the barriers to returning to work and consider how adjusting the work might help a patient overcome this. You can encourage the patient to access appropriate support and rehabilitation to help them back on this path.